Welcome back, my dear students. Now we'll continue with the remaining part of your permanent mandibular first molar. So in the previous session, we had learned on the buccal and the lingual aspect of your first molar. This session, we'll cover on the mesial, distal and occlusal aspect of your first molar. Before we proceed, we'll just have a recap over what we had learned. So we read on the buccal and also on the lingual aspect. Now when you compare between the two, on the buccal aspect you can visualize 5 cusps. That means the 3 major cusps of your buccal site and also small portions of your lingual cusp. So on the buccal aspect you have your mesiobuccal cusp, which is the biggest cusp, followed by distobuccal and your distal cusp, which is the smallest. So remember, your distal cusp is present at the buccal and the distal corner of it. So distal buccal corner, you have your distal cusp. Then if you look at the cuspal ridges, here it is flat, it becomes slightly rounded, and the distal cusp will have much more rounded cuspal ridge. If you observe the lingual cusp, there are 2 lingual cusps which you can see from the lingual aspect, that is mesiolingual and distolingual. And the cuspal slopes that you see here are placed at an obtuse angle, and the obtuse angle of the distolingual cusp is much more greater than your cuspal slope of your mesiolingual cusp. Also, you can see a very small portion of your distal cusp. Then if you observe, you have 2 grooves which is present here, your mesiobuccal developmental groove and your distobuccal developmental groove. Now this is a shorter groove which is going to end in your buccal pit. On the lingual aspect, you have a single groove separating your mesiolingual and distolingual cusp. Then if you feel for the surface, your surface is kind of smooth, and over the cusp it is convex. Here it is smooth and rounded or spheroidal in shape. Then you have a bulge here, that is at the cervical third, which you call as a buccal cervical ridge, which is a convex portion which is extending from the mesial side to the distal, which is running mesiodistally. And below the cervical ridge you can have a depression, that is a developmental depression which is present and can extend onto your furcation area. Then when you observe your outlines, that is your buccal outline and your mesial outline and your distal outline, your mesial outline is kind of concave and then it is convex from the contact area. Here it is straight and convex. Similarly, when you look at the lingual aspect, there's a difference here in the mesial outline. This is going to be convex till your marginal ridge. Here it is similar as your buccal aspect. You have convex and then it is straight. If you observe the cervical line, this is kind of regular and it has got a gentle curvature. The curvature is present towards your bifurcation area. Here it is very irregular and you have a sharp curvature which is present towards your bifurcation area. Then if you see, it is multi-rooted teeth, that means it has 2 roots where the roots are positioned towards the mesial side and towards the distal side. So you have a mesial root and a distal root. The root trunk and the difference between the root trunk on both the surfaces, if you observe, this is shorter and means the distance from the cervical line to your furcation area, here it is 3 mm, here it is greater distance, that is around 4 mm. Then if you look out for the roots are actually longer from the lingual aspect. So it is longer by 1 mm when compared to your buccal surface from the buccal. If you compare to the roots from the buccal surface, then you can see a developmental depression on the buccal surface near to your furcation area. So these are the basic features which you see in both your buccal and your lingual aspects. We'll move on to the next aspect, that is your mesial aspect. From the mesial part, you can visualize 2 cusps, that is on the crown. You can visualize your mesiobuccal cusp and your mesiolingual cusp. And then you can see a single root, that is your mesial root. The shape of the crown is kind of rhomboidal. From the buccal aspect, the shape of the crown was found to be trapezoidal. And like we had already said before, your buccolingual diameter is much more greater in the mesial aspect. Now, why is that mesial aspect has got a greater buccolingual direction? That is because when you observe, your crown portion or the tooth is going to converge towards the distal. If this is your mesial surface and this is your distal surface, from the mesial part towards the distal part, the crown is going to converge. So that is why anything that you visualize from the mesial, that is why you cannot see any other part of the tooth from the mesial aspect, because your mesial aspect is going to be much more broader. Then you have, when you take both buccal and lingual part, you will always have the crown tilting towards the lingual aspect. So the crown has got a convergence towards a lingual aspect, or the tilt towards a lingual aspect. If you observe the surface is going to be smooth and it's going to be convex. Now, when you compare between the two cusps, your buccal cusp, that is your mesiobuccal cusp, has got a flatter cuspal slope or a cuspal incline. So this cuspal surface is going to be flatter for your buccal cusp, while your lingual cusp will have a sharp, or it will have a obtuse angled cuspal slope, and it is placed at a slightly greater height than your buccal cusp. Along with these two cusps, or in between these two cusps, you will have your mesial marginal ridge, which is 1 mm below your cuspal tip. Your contact area, which is present below your marginal ridge, is present at the junction of occlusal and middle third, and below the contact area, this part, it is kind of flat or it is slightly concave. The cervical line that is present at the mesial aspect is irregular, and it is going to curve occlusally by 1 millimeter. So the curvature is towards the occlusal surface by 1 millimeter. So the crown area, you can visualize the two cusps. You can see the mesial marginal ridge, which is 1 mm below your cuspal area, and your mesiolingual cusp has got an obtuse angle and it is slightly higher than your buccal cusp. Then you have your contact area, which is in the center or junction of occlusal and middle third. Below the contact area, you have a flatter region. Then your cervical line, which is present, is kind of irregular and it has a curvature towards your occlusal surface. If you go for the outlines, the buccal outline, that is here. So from the cervical line till your cervical ridge, remember I told you, you have an elevation, or you have a ridge that is present, or a convexity that is present on the cervical third. So from the cervical line to your buccal ridge, this part is convex, and above here, above the buccal ridge, this outline, whatever you have till the cusp tip, can be slightly concave or it can be slightly straight. So this part till the cuspal tip is going to be straight or slightly concave. If you look at the lingual outline, from the cervical line to the middle third, it is kind of straight. So this part is straight. From here till the cusp tip, it is convex. So this part is convex. Here from the third to the cusp tip, it is kind of straight or flat. If you look at the cusp tip of your mesiolingual cusp, and if you divide the root into three portions, that is your buccal third, middle third and lingual third, your mesiolingual cusp tip is present at the lingual third of your mesial root, and your mesial root looks much more broader when compared to your distal root. And remember, you cannot visualize any aspects of your distal portion because of the distal convergence. Your mesial root has again two outlines, that is your buccal outline and your lingual outline. Now your buccal outline, from the cervical line, it is a straight line, and at the junction of your cervical and middle third, it is going to curve towards the lingual side. So till here it is straight, and then it will curve towards the lingual side. The tip of the root is present just below your mesiobuccal cusp. That means your cuspal tip is placed buccally. The cuspal tip is placed buccally, and you can find it just below your mesiobuccal cusp tip. Your lingual outline is straight till your middle and apical third. So from the cervical line, it is going to be straight till here. And then from here, it is going to tilt again towards the buccal tip. So it is the tip of the cusp is placed buccally. So from the middle third and apical third junction, it is going to tilt sharply, or it is going to tilt sharply towards your buccal aspects. And if you feel for the surface of the roots, you have bulk towards the borders, that is towards the buccal border and the lingual border, you will have bulk of the root. That is, the borders are convex, and these two borders is going to dip towards the inner portion, and in the center you will get like a valley like depression, or you will have a concavity in between the two convexities. So the borders are convex, so it is rounded, and finally it is going to dip in the center, and there you will get your concavity. This is your concavity, or the depression that is present between your two borders. The next aspect which you're going to learn is the distal aspect. Now, distal aspect is also somewhat similar to your mesial aspect, but remember one thing, since you have your curvature towards the distal aspect, you can visualize all the other aspects of the teeth. That is, you can visualize your mesial portions of the teeth, the remaining cusp of your teeth, even the root of your mesial root. So the border of your mesial root can also be visualized from the distal aspect, because the entire tooth is going to converge distally. And your buccal surface will have more convergence than the lingual surface. That is the other thing which you had said. Your buccal surface is going to converge towards the lingual side. So it will have two convergence. One is a distal convergence, and secondly it will have a buccal convergence. Now when you look from this aspect, your distal cusp is what you're going to what is going to face in this aspect, or what is going to appear more prominent, because this cusp is present towards this side, and remember this is present at the corner of your distobuccal region. So it is tilted, so you can visualize the cusp from your buccal side also from your distal side. And if you look at the contact area is just present below your distal cusp, and it is slightly higher than your mesial contact area. So here this contact area is placed at a greater height when compared to your mesial aspect. The surface, when you feel, it's going to be convex above the cervical, convex throughout, except near to your cervical line, which is going to be flat. So this part is going to appear flat. The remaining part, it is going to be convex. You can also observe your distal marginal ridge. Now, when you compare it with the mesial marginal ridge, this is short and obtuse. See, you can see here, it is short and it is kind of obtuse. It's placed as an obtuse angle, and it is lower than your mesial marginal ridge. So this is present at a lower height than your mesial marginal ridge. Your cervical line here is very irregular. See, you can see different curvatures on this line. So it is very, very irregular. When you look at the root, the lingual border of your mesial root can be observed. That is because of the distal convergence. And if you feel for the surface of the root, it is kind of flat. So there you had convexities and concavities. So in the center you had a concavity. Here if you feel, it is kind of flat throughout. You don't have ups and downs. But here again in the center you can have a mild depressed area. But the depression is much more shallow when compared to your mesial aspect. So mesial aspect has got a larger concavity or a larger depression. But this is very, very shallow. Other than that, you have a sharper apex. So the apical third is kind of rounded with a sharper apex. The last aspect of your mandibular first molar, that is your occlusal aspect. Now this shape of the occlusal aspect is pentagon or it is hexagonal, and the convergence again towards the distal side. So it is going to converge towards the distal side, plus the tapering is towards your lingual side. From the buccal it is going to taper towards the lingual side. So two convergence. Then we had learned in the first aspect that your mesiobuccal dimension is much more greater than your buccolingual dimension. So the tooth is larger in this aspect than your buccolingual aspect. Also, you learned about the lingual inclination of your buccal surface towards the lingual aspect. When you observe the cuspal, the number of cusps that is present, you will have 4 major cusps along with a smaller cusp that is your distal cusp. Now, among the 4 major cusps that is present, the largest one is your mesiobuccal cusp. So this is your mesiobuccal cusp, which is the largest cusp. That is followed by your lingual cusp, which is almost equal in size. That is, your mesiolingual is almost equal to your distolingual cusp, followed by your distobuccal cusp, and the smallest cusp that you have learned is your distal cusp. And remember, using the distal cusp as your reference point. So that will be your reference point for the identification of your mandibular molar, the sides of your mandibular molar or the arch to which it belongs. So based on the distal cusp, you can identify the mandibular molar, the arch of your mandibular molar, whether it belongs to your right side or whether it belongs to your left side. So that is your reference point. Then you can see other features other than the cusp. You can see features like your ridges, foci, pit and your groove. So these are the other landmarks which you can see on the occlusal surface. Now when you look at your triangular ridges, hope you remember what is a triangular ridge. It is an elevation, it is a linear elevation running from the cuspal tip to the center portion down towards your developmental groove. So all your cusp here, all your 5 cusp can have triangular ridges, and your triangular ridges of your lingual cusp is much more developed, or it is much more well defined than your buccal triangular ridges. Then you have your other ridge, that is your mesial marginal ridge and your distal marginal ridge. These two are your marginal ridges. Your distal marginal ridge is at a lower level. It is shorter and it is obtuse when compared to your mesial marginal ridge. The foci that you see, you can see 3 foci. That is your central foci. You have your mesial triangular foci and your distal triangular foci. Now these two are in the shape of a triangle. So you have your mesial triangular and your distal triangular foci. Your central foci is the one which is present exactly in the center part, and it is a large circular depression. So it is a shallow depression which is a large circular depression present in the center. The other two are triangular shaped, which is present on the mesial and distal aspects. Now since it's a triangle, it will have a base and it will have an apex. So the base of the triangle is towards the marginal ridge. See, observe here, the base of the triangular fossa is towards the marginal ridge, and the apex of the triangle is towards the mesial and distal foci, or mesial and distal pit. Sorry, it is towards the mesial and distal pit. So there's a pit here. You have a central pit and you have a mesial and distal pit. So the apex of your triangular ridge is towards it will end in the mesial and distal pit. So this is another diagrammatic representation. These are your grooves. These are your cusp. This is your distal cusp which is present here, and these are your lingual cusp. The other landmark which you can see is the groove. Now it has 4 grooves which is present. You have your central developmental groove which is separating both the lingual and buccal lobes. Then you have your mesiobuccal developmental groove and your distobuccal developmental groove which is present on your buccal aspect, and your your lingual developmental groove which is present on the lingual aspect. So it will start from the central developmental groove, run between the cusp and separates the cusp, and it will run in their it will end or terminate in their respective surfaces. The pits that you can see 3 pits. You can see a center pit and you can see a mesial and distal pit. And your mesial distal pit is located near to your triangular foci. The central pit is located towards your central foci. Now this is just the diagrammatic representation of all the surfaces of your teeth. This is your buccal surface. So you tend to visualize the 5 cusp, the buccal cervical ridge, the depression, the percussion area which is 3 mm, the roots which are 2 roots, that is your mesial root and your buccal, your mesial and the distal root, and the curvature of the roots here. Then this bifurcation area is slightly larger than this area. Your cervical line is irregular. You have two cusps here, and the cuspal slopes here is at an inclination, while the cuspal ridges here is flatter. And the roots appear longer from your lingual aspect by 1 mm. Then if you observe between the mesial surface and the distal surface, your mesial surface is much more broader than your distal surface. That is because of the distal convergence. Here you can visualize the two cusps, that is your mesiobuccal cusp and your mesiolingual cusp, and this cusp is placed at a higher level than your mesiobuccal cusp. Your mesial marginal ridge is present, which is 1 mm below your cuspal level. Your cervical line is kind of regular and it has got a curvature towards the occlusal surface. The root appears more broader and it has convexity on both the borders, that is both your buccal and lingual border is convex, and in the center it has a concavity or a depression. When you look at the distal aspect, since the tooth is converging distally, you can visualize all the other parts of the teeth from the distal aspect. And what is more prominent here is your distal cusp, which is the smallest cusp, and your contact area is positioned at a higher level when compared to your mesial aspect. And you have your distal marginal ridge, which is obtuse, which is shorter and at a lower level than your mesial marginal ridge. Your root is slightly less broader than your mesial root, and because it is less broader, because of the convergence, you can visualize the lingual border of your mesial root. And the concavity in the center here, you can have a very mild concavity or a depression. It is very, if present, it is very shallow when compared to your mesial aspect. So as such, the mesial aspect, the distal aspect of the root is flatter than your mesial aspect. And then the last aspect which you learned was your occlusal aspect. So from the occlusal aspect, remember it has convergence distally. So towards the distal side it is converging, and also the buccal side will converge towards the lingual side, or it has a lingual inclination. And you can visualize all the 5 cusps, with mesiobuccal cusp being the largest, the lingual cusp of equal size, followed by your distobuccal cusp, and your smallest one is your distal cusp. The other features that you observe here is your central developmental groove, your mesiobuccal developmental groove, distobuccal developmental groove, and your lingual developmental groove, which is going to end, it will start from the center part and it will end on their respective surfaces. Some amount of very few supplementary grooves can also be visualized. Then you have your pit, you have a central pit, then your mesial and distal pit. Also, you have your central fossae and your mesial and distal triangular fossae. And all the cusps will have triangular ridges, as well as you have 2 marginal ridges, that is your mesial marginal ridge and your distal marginal ridge. And your fossae here, that is your mesial triangular fossae and distal triangular fossae, since it's a triangular shaped, your base of the triangle is towards a marginal ridge and the apex is towards your mesial and distal pit. So these are the main features which you can observe on the different aspects of your tooth. Thank you, and the next session I will cover on your mandibular second molar as well as your third molar. Thank you.